Hi, I'm Dr. Greg Stern, Stern Chiropractic, helping you and your kids maximize your health, performance, and quality of life naturally. Well, last month I talked about why pregnant moms need chiropractic care, and I alluded to something called the Webster Technique, and that's what I'm going to talk about today. You see, the Webster Technique is a specialized chiropractic technique that can be used with anybody, but it was specifically created for pregnant moms to help them have the best possible pregnancy and avoid any issues with breech presentation or something called dystocia, which is a failure to progress during labor. You see, dystocia is caused by three main reasons, according to Williams Obstetrics, the main obstetrics textbook. It can be caused by power. That's the nerve system innervation to the uterus. It can be caused by passage. The pathway, the birth canal that the baby passes through can be too narrow. Or it can be caused by passenger, which is actually the baby not being in the proper position. The Webster Technique was created to help with all of these three reasons. You see, chiropractic is designed to clear the nerve system to maximize and optimize the function of our bodies. And the nerve system controls how the uterus functions and how it contracts. So you need a well-functioning nerve system for that uterus to contract appropriately at the time of labor and delivery. And that's what the Webster Technique helps with. In addition, the Webster Technique balances the pelvis so that passage that the baby passes through from the uterus down through the birth canal right through the pelvis, that passage is properly aligned so there's the most possible room for that baby to travel through. And finally, chiropractic should be utilized throughout the pregnancy. But yes, I do have moms call all the time later in their pregnancy saying, "Hey doc, I'm breech. I found you online. I saw you do the Webster Technique. Can you help me?" Well, I don't treat breech presentation, but by using the Webster Technique, clearing the nerve system, balancing the pelvis, and releasing a lot of tight ligaments and muscles in that pelvic cavity, it allows plenty of room for that baby to get into the best possible position for labor and delivery. You see, the uterus is like a big balloon, and it's tethered to the pelvis by ligaments. When the pelvis gets out of alignment, and that can happen pretty easy during pregnancy because the body is releasing relaxin, a hormone designed to loosen up the joints so they can expand for that baby to come out properly. Well, when the pelvis is out of alignment, it also causes some twisting and torsion in that uterus. And that torsion can block the baby being able to naturally turn its head down. So through the Webster Technique, I balance the pelvis, I take the tension out of the ligaments, I ease the tension in the surrounding musculature, which allows that uterus to open up wide again, allowing the baby the full amount of room it needs, not only to develop during pregnancy, but also to turn head down for labor and delivery. So again, the Webster Technique is designed to help moms with all of these three reasons that cause dystocia or a difficult labor. So please, if you're pregnant or you know of someone that's pregnant, share this video. Let them know, because coming in throughout the pregnancy for chiropractic care usually helps moms avoid issues of breech presentation. But if you're there at the end and you are breech, this is a great natural approach to try before you go in the hospital for a version and possible C-section. And make sure to go to the website, www.sternchiro.com. Go to the newsletter archive. Check out our 23 years of health and wellness newsletters. And check out our maternity page. It shares a whole bunch of information about why moms need chiropractic care during their pregnancy, as well as the Webster Technique. I hope you found this helpful. I look forward to seeing you next month. Have a great month. Peace.